Time and time again, parents share stories of what their experiences were like during the process of having a hearing screening performed on their newborns, and the clear majority of those stories are not positive. The way in which information is shared with parents is a make or break situation regarding their emotional response. While any news short of your baby passed may cause an emotional reaction, increased sensitivity on the part of the newborn hearing screening staff is a key to making the experience less negative for families. The North Carolina Early Hearing Detection and Intervention Program, known as Eddy, has partnered with the CARE Project to offer this sensitivity training to all staff who encounter these families as they welcome a new baby into the world. The CARE Project is a nonprofit organization that provides emotional support for families with children who are deaf and hard of hearing. According to the National Institutes of Health website, hearing loss is the most common congenital condition of babies born today in the United States. About 2 to 3 out of every 1,000 children in the United States are born with a hearing loss in one or both ears. More than 90% of deaf babies are born to hearing parents and have no known risk factors. Hearing loss is invisible, or at least not obvious. As stated in the 2013 Joint Committee on Infant Hearing supplement to the 2007 position statement, during the early stages of life, the brain builds the nerve pathways necessary for understanding auditory information. For these reasons, we want to identify hearing loss as early as possible, by the time a child reaches 3 months of age. This enables parents to pursue treatment options early so that a child can learn to communicate comparably with his or her hearing peers. The most intensive period of speech and language development is during the first 3 years of life, a period when a child's brain is developing and maturing. If a child is not exposed to language during this period due to hearing loss, he or she will have more difficulty developing spoken or signed language as well as reading skills. Hearing screening is the first and a very important step in the early hearing detection and intervention process. Infants who do not pass newborn hearing screening need to have follow-up testing to determine if hearing loss is present, and intervention needs to be started as quickly as possible to provide the best language and learning outcomes for the child. For the benefits of universal newborn hearing screening to be fully realized, screening must be appropriately coordinated and linked with diagnostic and early intervention services and the child's medical home in a way that is family-centered and culturally competent.
You know, we wake up and we hear. Growing up with children and, learning to speak properly, you never realize that the hearing is so important. It can be so involved.
Eddy stands for Early Hearing Detection and Intervention. Eddy has 3 parts. The first part is the Newborn Hearing Screening Program. Eddy also includes audiological diagnostic evaluations and early intervention programs. In 2000, 44% of all newborns were screened for hearing loss. Today, almost all the newborns are screened. Because of this, thousands of infants with hearing loss and their families are benefiting from early intervention. Every state has an early hearing detection and intervention program. The overall goal of the program is to have every newborn screened and rescreened by 1 month of age. This includes the hospital screen and the follow-up outpatient rescreen. By 3 months of age, the infants that do not pass the newborn hearing screening should have a diagnostic evaluation so that they are receiving early intervention services by 6 months of age. Early intervention also includes amplification if it is appropriate. In the United States, 34% of the babies that do not pass their newborn hearing screen are not being followed up, according to the Centers for Disease Control and Prevention, also known as the CDC. If you think about it, this statistic is high. We are missing many babies that have a hearing loss but are not receiving services by 6 months of age. If hearing loss is identified at a later age, it is very hard to get the child caught up. Why is this number so high?
So through this workshop that I attended, I was able to view a lot of videos of families that were starting their journey, that was going through the journey, that had gotten their information that their child did have some hearing impairment, and was able to kind of experience, in a sense, what they were going through in their journey. And I was impacted in a way with the screening and the approach is that it allowed it to come full circle for me, and realizing that the screeners are the very first contact with the family of a child with hearing loss, and how that is like the very beginning of their journey.
Why is this important? Screeners are the first contact with families and are the first ones to share the news with the parents that there may be potential unexpected news about hearing status. Parents are going to remember what you say to them if their child becomes identified later on. How the initial screening results are given to the family influences how likely they will be to make sure they schedule and attend the follow-up test. This will hopefully reduce the number of babies that are lost to follow-up, as previously mentioned in an earlier slide. Parents are going to react to how you deliver the news. Your job has two roles: to give information and to give emotional support. Most professionals who interact directly with families who have newborns, hearing screening staff included, have not had any training on being emotionally sensitive, also known as adjustment counseling support. Historically, we are trained to deliver information about whatever is happening from a medical clinical model. Often, the information is shared and staff walk away. Everyone who works in a hospital or clinical environment is very busy. It is imperative that we all take a moment to realize that the information we are sharing may be upsetting, and we need to find a way to make the delivery of that unexpected news more comfortable. We cannot just drop and run with results of the hearing screening in the case of a baby not passing. Parents react in many ways, and it is not comfortable. Some families may be happy that their child did not pass the hearing screening because hearing loss is a part of their culture. Other families may be relieved because their baby has many complicating factors, and they just want to know what's going on. Over 90% of parents who have a baby born with hearing loss are normal hearing themselves, and the unexpected news is likely going to be more upsetting. Parents react in many ways. Some may deny that there may be a problem. Others may isolate from other family members, friends, and neighbors. Some may embrace this as good news if they themselves are from deaf culture. The bottom line? No one can predict how parents will react, so we must be as sensitive as possible.
Everybody says, that's what they say, is it could be worse. And, you hear that a lot. And I think I've heard in other videos, which help, is it can't be worse. Not at that time. Someone tells you, wow.
Yeah, in that moment.
Tells you that something's wrong with your kid. No matter what it is, I can't. It can't be worse at that time. But with all our help and research and meeting people like Johnny Sexton and the CARE Project, and just so many people that help you, you're really prepared to handle any situation with hearing loss, and it's great.
It is important to remember that those of us who provide services for these families cannot be successful with parents if we are unable to approach them without sensitivity to their emotional journey. Feelings just are and cannot be controlled. Behavior can be controlled, and how we deliver the unexpected news to parents will help shape their response.
Since hearing loss is something that you're not expecting as a surprise during the first or second day, and also I know that it's very hard to deal with this kind of news for the parents. I think that it's very important to educate in certain ways the technicians that are doing the screening, the initial screening. I know that it's hard for them because they don't want to carry that at home, or it's not a nice job to deliver bad news. But I don't know, they should find some nice ways to deliver. That is not nice, and probably they're expecting different reactions from parents too. But it's good to know that, okay, I understand you, and you're going through something difficult. Now, let's do something.
You as the screener play an important role in getting the babies to the diagnostic phase. Our goal is to help you understand what the families and professionals go through when unexpected news is delivered. The feelings you as the professional and the family experience are evolved around the emotions or the elephant in the room. It is uncomfortable, and we will talk about ways to use this information to help communication between you and the families. Think about how you would deliver the unexpected news. You want to plan and be confident in what you are about to say. Hopefully, by the end of this presentation, you will have the tools to help make the families feel more comfortable and less anxious about the outcome. Parents are dealing with a loss. The dream they may have had for their baby suddenly may be threatened in their minds. They do not know that it's okay to grieve or react to unexpected news. Do you remember a time when you have experienced grief? Every person has had or will have a grief experience in their lives at some point. Grief is a process. Grief is a part of life. It happens to everyone or almost everyone. Grief comes and goes. Grief can have a positive outcome as any individual progresses through stages of grief. Everyone experiences grief differently. Both families and professionals are impacted by grief. Grief is a journey. Grief comes in different forms: critical illness diagnosis, loss of a pet, inability to have children, body image issues, divorce, failure at school, failure at work, loss of job, learning your child has hearing challenges, news of hearing status. These examples may cause any individual to go through a grief period. Grief means different things to different people. Sometimes parents are just happy that the baby is alive. If a baby is born with multiple issues, deafness may be the least of their worries. Or if they struggle to just have the baby, then they may be okay with hearing loss. Men and women will react differently. The siblings and extended family will have different reactions. In many cases, hearing loss may even be celebrated and accepted in the family. Hearing screeners should be aware of all of these factors. If parents truly do grieve over the news that their baby did not pass the hearing screening, there are stages that they may go through. When parents receive news that they did not expect, usually the first reaction is shock. Parents are stunned because what they are hearing doesn't fit in with their vision of having a baby. Many feelings may surface and parents will react in some of the following ways: upset, cry, traumatized, hysterical, blown away. After the shock begins to wear off, many parents may enter a state of denial. Not my baby. This can't be happening to me. It isn't true. It can't be true. The hearing screener must be wrong. Reject the news. Total disbelief. Parents will eventually begin to realize that this news is true, and then the pain sets in. Many words have been used by parents to describe this pain: aching, hurt, tortured, wounded, suffering, undone, anguish. When people are emotionally wounded, an immediate reaction often is anger. Parents who get this news about the hearing screening on their baby will get mad about it and may start blaming others for it, even blame the other parent at times. Parents may lash out at others, becoming outraged and furious that this is happening to them. Depression may very well follow the anger. The truth sinks in. Parents realize that what they envisioned is indeed not their reality now. Many parents feel bad and have a sense of hopelessness for a period. We must always remember that this is a part of a normal process of grieving. Usually, with the encouragement of others, parents will eventually embrace the truth. They will realize that it is time to move forward and get the information needed to have a clear indication of where they go next in life. During this time, it is important that parents find a peace about the situation within themselves, as well as with those around them. Remember that anger stage? Relationships can possibly be damaged when a parent is lashing out at others, especially if the anger is directed to each other. Parents cannot stop at the point of acceptance. Families must move forward to learn and understand how best to advocate for their child and for the best life possible for their family. All families want this for their children and themselves, and it is no different because a baby may have a hearing problem. Throughout the child's life, the parents and the family may find themselves experiencing some form of grief again. This is also normal. There will be transitions for the child from early intervention to preschool, from preschool to kindergarten, to elementary school, to middle school, to high school and beyond. Parents will have some of these emotions surface as their child moves through these different periods. But then again, all parents have these feelings as well. Remember, grief is a part of life and can surface any time along the family journey. Here are the stages of grief that we just discussed. Not all parents grieve the same way, and some may go through all of the stages and others just a few. Grief is a journey. It is not easy getting from point A to point B. The journey can be messy and unpredictable, as you see depicted here on this slide. The emotional journey begins before the birth of a baby. Parents anticipate the birth of their baby, and a bond is established before the birth occurs. Many wonderful, happy thoughts occur. My baby will be perfect, normal, beautiful, smart, but there is news that comes in some cases that is unexpected. You still have a beautiful, normal, wonderful baby. It's just a slight detour on your journey, a detour that wasn't expected. However, the destination is still beautiful. Here is a story that is often told to parents who receive unexpected news with the birth of a new baby. Welcome to Holland by Emily Pearl Kingsley. I am often asked to describe the experience of raising a child with a disability, to try to help people who have not shared that unique experience to understand it, to imagine how it would feel. It's like this. When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks and you make your wonderful plans. The Colosseum, the Michelangelo David, the gondolas in Venice. You may learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The stewardess comes in and says, "Welcome to Holland." Holland, you say? What do you mean Holland? I signed up for Italy. I'm supposed to be in Italy. All my life I've dreamed of going to Italy. But there's been a change in the flight plan. They've landed in Holland, and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy place full of pestilence, famine, and disease. It's just a different place. So, you must go out and buy new guidebooks, and you must learn a whole new language, and you will meet a whole new group of people you would never have met. It's just a different place. It's slower paced than Italy, less flashy than Italy, but after you've been there for a while and you catch your breath, you look around, and you notice that Holland has windmills, and Holland has tulips, and Holland even has Rembrandts. But everyone you know is busy coming and going from Italy. And they're all bragging about what a wonderful time they've had there. And for the rest of your life, you will say, "Yes, that's where I was supposed to go. That's what I had planned." And the emotions connected to the unexpected news will never go away because the loss of that dream is significant. But if you spend your life grieving the fact that you didn't get to Italy, you may never be free to enjoy the very special, the very lovely things about Holland. If the baby does not pass the newborn hearing screening, it will be unexpected news in most cases. However, in some cases, the unexpected part might be that the baby did pass the newborn hearing screening. Remember that families will differ in their emotional reactions. And so the process begins. Parents learn something different from what they had expected. Professionals, as they should, dump lots of information on the parents because it is our job to do so. Parents are usually not allowed enough time to process the emotional reaction to the unexpected news. Professionals may feel uncomfortable and/or untrained to lend emotional sensitivity to the parents if they do get upset. You, as the screener, are the professional. What you say and how you say it will have an impact on the families. You don't want to dump a lot of information at once. Anytime unexpected news is delivered, only the first two sentences are the most memorable. Do not deliver misleading messages such as the baby failed. Instead say, the baby did not pass and this is a screening. Do not say, probably nothing is wrong, everything will be fine. You never want to tell a parent how they are supposed to feel. This is a screening, not a diagnostic, so you do not say that the baby has hearing loss. We do not know at this point. Do not blame it on broken equipment or fussy babies. Please don't try to explain it away. We deliver the results and encourage them to follow up.
The one thing that I know everybody says about her is, obviously, she's adorable, but she's so happy. And they're almost surprised that she's so happy. And for us, I don't feel like it's a surprise that she's happy because this has been life as she knows it for the entire time. Her adventure has been interesting to say the least. She failed two newborn hearing screenings in the hospital, and everybody just brushed it off. Don't worry, probably just fluid. I guess that's a generic thing that they tell everybody, but it felt very brushed off, and that happened 3 times total, and they did that. And I felt like maybe we should have been a little bit more prepared, but that's all right. So we did our second one, she failed it again. So they did a referral. They said sometimes it takes a couple of weeks for the fluid to go away.
When given shocking news, memory shuts down. Keep information short and to the point. They will only remember the first 2 sentences. A critical strategy that I highly recommend is called hitting the pause button.
My name's Michelle Bryan. As I was leaving the hospital with my daughter, my husband was downstairs pulling the car around, and I was leaving with my things, and the nurse stopped me on the way out and said, "Oh, by the way, she failed her newborn hearing screening. You might want to get that checked out."
Once you have shared the hearing screening results when a baby does not pass, stop and ask what questions the parent may have. Ask them what they need. Some parents may need time to process the news while others may not. Some parents may become emotional. Don't leave the parents hanging with no closure and no plan. Take a break before giving more information and make sure you follow up soon afterwards.
So Dylan was born, and he's a year younger than Megan, and he had failed a newborn hearing screening. And honestly, my second child, so when I got the folder from the hospital and it had the Social Security information about him to get his Social Security card and his footprints, and then as I was digging through, the breastfeeding information and all the information they give you, there was a little slip of paper that said, your baby's hearing was tested today, and it either they check off pass or refer. And so it said refer, and I just thought, okay, I didn't even understand what that meant at the time. You're just, as a parent, you're overwhelmed with just giving birth and then getting that paper with all the other stuff, and you're really just looking at the footprints and you're looking at your healthy baby. And to be honest with you, when I had talked to people about getting their baby's hearing screened later, I was always kind of laughable, like, what are you going to do, put these little earphones on the baby and they're like, raise your hand when you hear something? Like, how do you test a baby's hearing? That'll just tell you how ignorant I was, being a college-educated mother, and my husband's college-educated, because we didn't even know anything about considering hearing loss. We have no hearing loss or deafness on either side of our families, so it was just kind of like, okay, going through the motions, whatever, we'll have his hearing checked.
Do give a positive message. Your baby didn't pass the hearing screening in one or both ears, which means that more information is needed about your baby's hearing. The next step is to have a hearing rescreen. Do give families the My Baby's Hearing Screening brochure or your hospital brochure. Tell the parents, here's a brochure that explains your newborn hearing screening. Then discuss how the family should follow up with a rescreen appointment according to your hospital screening procedures. If possible, work with the family to schedule the appointment when the baby will be 10 to 20 days old. Getting a refer in one or both ears should be handled the same way. A refer in one ear can still cause communication issues and developmental delays. The importance of a hearing screener is to relay to the parents how important it is to follow up.
You want the best for your kid. You don't want your kid to be any different than, anybody else.
We would hear the stories from the the audioverbal therapist that a lot of the parents just ignore that there's, no hearing loss with their child, that it's not a problem. Or
There's some parents that do go through the denial of it and don't take that next step and get their kids' hearing fixed.
Hearing screeners can be a positive influence on the lives of children and families. Thanks for your time and attention.
Our third son was screened when he was a baby, when he was first born. And the screener, was doing the screening, and he did it several times and was kind of looking like, something was wrong. And I'm like, what is it? He said, oh, there's probably something wrong with the, with the equipment. Or maybe there's some kind of problem there. It's also possible that, your baby has, fluid in his ears, and that could affect the screen. If that had been my first experience with a screener and baby hearing screening, I would have been really happy, to accept that probably my baby was fine. And I would go home and, make a lot of noise in the house, bang pans and check and watch, and I would see my baby was like reacting to that. And I would be, satisfied. Oh yeah, he can hear fine. I'm not going to go back for more evaluation. I don't need to go back and have him screened again. I knew that there could be a problem. So if I had one thing to say to screeners, it would be straight with the parents. If their baby did not pass, it means that the baby needs to come back for more evaluation. If their baby didn't pass, you need to tell them, your baby didn't pass. The next step, tell them clearly, the next step is further evaluation. If you feel confident about the screening results, the parents are going to notice that. And they will listen to what you're saying. And it's possible, it's really possible, that you are the first person in that mom's life that she meets on her journey of raising a deaf child. And you can make a really positive influence on the life of that child. Thank you.